So here is part 3 of my series on optic neuritis. So in part 1, I talked about what optic neuritis is, what the common symptoms are. In part 2, I talked about the common causes of optic neuritis. And in part 3, I want to share with you the treatment for optic neuritis. So in many cases, if the vision is poor enough, usually worse than 20/40, and the patient is very symptomatic, we opt to treat. And treatment includes usually IV steroids. Now, the clinical studies on optic neuritis used IV steroids for 3 days. So 3 days of IV steroids in the form of Solumedrol, 1 gram a day for 3 days, followed by an oral taper for a total of 2 weeks of therapy. There are some doctors who do slightly different variations on that theme of steroids. They may give 5 days of IV steroids and then no oral taper. And then there are some doctors who give oral steroids at a very, very high dose and then taper over several weeks. So there's different treatments. If somebody does not respond to steroids, there are other more aggressive types of treatment that can be used, including plasmapheresis, which is called PLEX, in which your body is basically filtered, your blood is filtered out of inflammatory chemical mediators and inflammatory cells that may be triggering the optic neuritis. Also, in some cases, IVIG can be used, so IV immunoglobulin can be used, and there are other immunosuppressants and biologic agents that can be used as well for optic neuritis. So put your questions below.